Well, it might sound too good to be true, losing inches from your hips, your waist, your belly without invasive measures. Our next guest says it can happen and it works. Dr. Carl Chacho from Weight Loss Fairfield is here to tell us about iLipo. I like the sound of this, doctor. So no invasive measures and you're kind of just melting fat away.
Absolutely, that's the way it works, yeah.
Go into a little bit more detail for us. How does it disappear?
Okay, well, first it's important to know that iLipo is an FDA-cleared technology, which means the FDA has looked at it and it works. There are other technologies out there which may not have been FDA-cleared and some of them, frankly, don't work. And the technology is relatively straightforward. This is the laser pad, and this pad is placed on the skin in the area where you want to lose the weight. The laser then comes from these slight openings on the bottom of the pad, and the laser energy causes the fat beneath the pad to break down into its component parts. An enzyme called lipase is released from the fat, breaks the fat down. The fat then goes into your circulation where you can metabolize it. So it works very good, not only for people who just need to lose weight in general, but for people who have particularly difficult areas where they can't seem to get rid of that fat no matter what they try.
Well, you could pinpoint it and just put the lasers directly on an upper arm if you wanted to. No, how long does this last?
In terms of how long does the fat stay away?
Correct.
That's a very important question. And I always ask patients before they start, has your weight been stable or has it been gradually increasing? Because if it's been increasing, this will get rid of the fat. However, it's going to continue to increase unless you have some type of lifestyle change.
I see.
And the lifestyle change may simply be doing the small amount of exercise that is required to have this work. People often find out also they can see the results almost instantly, and that gives them incentive to maybe watch a little bit more what they eat and maybe get a little bit more exercising.
There's got to be motivation if you see that instant results there. And how long is each process or each visit?
The actual laser treatment is 20 minutes. The initial visit that we have is 1 hour, where it's a medical procedure. I take the medical history, we do a brief physical, we sign all the paperwork, and then we measure the patient, making marks on the skin exactly where the person wants to lose the fat. We do the treatment and measure again afterwards to see the results. The actual treatment is 20 minutes with the lasers. And
you could go right back to work, non-invasive. So what does it feel like?
Interestingly, most people say it feels a little bit warm. Okay. But other than that, I mean, most people like it. Some thought maybe it's a little too warm, but most people like it. It's like kind of having a heating pad on.
Not bad. Well, we have some before and after pictures, Doctor. We'll put them up on the screen. You can kind of explain what we're looking at. Okay. Although I think that's pretty clear what we're looking at.
Well, yes, you can see the two pictures. This also takes care of cellulite, which might be obvious in this picture. But you can use it, for example, to lose weight off the thighs, which is one of the more common areas for women.
And you would lay kind of face down, and then you would put the lasers around your thigh
Typically,
area?
you lie on your back, and we have a band that goes around your thigh, which allows us to place the pad right over the area of maximum fat. And that band, which is about 2 inches wide, goes around your leg and holds it in place.
Wow, I mean, you could tell that the saddlebags on the side really diminished in that shot. All right, now we have the belly here.
And this is, again, a nice example of what you can do with abdominal fat, with lower abdominal fat. And you can see the three pictures there of the progression of fat loss as this person goes through the treatment.
Okay. Now this was where did you put the lasers on this?
Okay, this is treating a little bit of the sides of the face and the jaw area. If you look under the jaw, that's an area that we have special small pads that can treat the fat that's under the jaw.
Wow, big differences there. And doctor, you specialize in reproductive care and infertility. This might be something a woman might consider before getting pregnant if she has to lose weight?
That's true. We know that women who are at a good body weight before getting pregnant have pregnancies with lower rates of complications. So it's good for someone in that situation. What is also, particularly in my business, very good for is there's a certain condition where women who carry a lot of weight in their midsection may have a hormonal imbalance because of that fat. And we can use this technology to get rid of that fat, so they might be able to get pregnant without having to use fertility drugs or invasive therapies just by losing the fat that's in their abdomen.
Very good. Well, sounds like a great thing here. A little bit of exercise, non-invasive, and you're losing inches almost instantly.
That's correct.
Doctor, thanks so much.